Dear viewers, welcome to our learning community. We share high-quality educational content and MCQ practice designed to help students in medicine, dentistry, nursing, physical therapy, and pharmacy master medical sciences with clear and strong understanding. Our goal is to support your preparation for international medical exams. We are fully committed to following YouTube community guidelines and international standards. Every video is carefully designed to strengthen your understanding, inspire your success, and make the journey of education both effective and enjoyable. Thank you for being part of our community together. We learn, grow, and create a brighter future.
Dorsal column, medial lemniscal pathway, DCML. The DCML pathway transmits fine touch vibration and conscious proprioception. First-order neurons ascend ipsilaterally in the fasciculus gracilis and fasciculus cuneatus, depending on whether they carry signals from the lower or upper body. In the medulla, they synapse in the nucleus gracilis and nucleus cuneatus. Second-order fibers then decussate and form the medial lemniscus, ascending to the thalamus. Lesions below the decussation cause ipsilateral sensory loss, while those above result in contralateral deficits. Spinothalamic tract, anterolateral system. The spinothalamic tract carries pain, temperature, and crude touch sensations. First-order neurons enter the spinal cord and synapse in the dorsal horn. Second-order fibers then cross within one or two segments through the anterior white commissure and ascend contralaterally to the thalamus. Lesions in this tract cause contralateral loss of pain and temperature below the level of the lesion. and lower motor neurons. Syringomyelia damages crossing spinothalamic fibers, causing bilateral loss of pain and temperature in a cape-like distribution. Recognizing these patterns allows precise anatomical diagnosis. Conclusion. In summary, the spinal cord is the main highway for communication between the brain and the body. The ascending tracts carry sensory information upward, while the descending tracts send motor commands downward. Mastery of these pathways is a foundation for understanding neurological function and localizing spinal cord lesions. Remember, to master neurology, one must first master tracts. Thank you for joining the session on the neuroanatomy of ascending and descending tracts of the spinal cord. Thank you for watching. If you found this lecture helpful, don't forget to like, subscribe, and hit the notification bell so you won't miss future lessons. Keep learning, stay curious, and see you in the next session.